Welcome everybody. Let us take up the ophthalmology mnemonics. Keratoconus is a very hot topic. So how will you remember it? Remember the mnemonic cones. There's a corneal scarring and Flischker ring. Oil drop reflex and edema. The high drops. O for edema. O for oil drop reflex in keratoconus. The nerves are very prominent. So in the cones, N is nerves. Nerves are very prominent. There's an excessive bulging of the lower lid on down gaze. That's called Munson's sign. You remember, no? So whenever the person looks down, there's an excessive bulge of the lower eyelid, which is called Munson's sign. Then S for striae, cones is the word. S for striae, they're called walk striae is what you should remember. So that is the keratoconus. So how do you remember Behçet's disease? You can remember oral upset. Behçet's disease is all known for the oral ulcers, no? So you remember oral upset. So what do you have in Behçet's disease? Occlusive periphlebitis. Around the veins there is inflammation. Then retinitis, anterior uveitis. And if you happen to do the fluorescein angiography, there is a leakage from the retinal vessels. There is an ulceration, both aphthous and also genital ulceration. Then you remember oral upset. P is pustules after the trauma of the skin, which is called Pathergy's test. Then the scratching leaves the lines. That's called dermographism in Behçet's disease. And erythema nodosum, which is nothing but inflammation of the fat. And thrombophlebitis. So these are the features of the Behçet's disease. You are going to remember it with oral upset. Now, what are the various instruments you use for sterilization in ophthalmology? One of the favorite questions. We use autoclaving, boiling, and the chemicals like alcohol and isopropyl alcohol, Sidex, 2% glutaraldehyde. So they are the chemicals. Similarly, the oral heat, ethylene oxide for the sterilization of the IOL, and we also use fumigation and gamma radiation, where the radiation comes from cobalt-60. So 3-minute short videos on Incus learning app. Thousands of them are there to help your exam preparation. Please welcome. Thank you.